The purpose of this video is to give you step-by-step instructions for administering a rectal enema. Enemas should not be painful. However, your child may feel pressure from the catheter and the contents of the enema. This is normal. It can be helpful to involve your child in the enema process. Allow them to help set up the supplies and give them choices about the enema, such as the timing of the administration of the enema, the position that they're in for the enema, or other appropriate choices. This helps them feel like they are having some control in the process. The first step in the enema process is to create the recipe for your child's enema. The enema ingredients are a mixture of normal saline, 99% USP glycerin, and Castile soap. Your doctor will prescribe an enema recipe that is specific to your child. Normal saline is the main ingredient, and glycerin and Castile soap are the additives that will stimulate the colon to help move the stool through. To start, you will need a container that goes up to at least 500 milliliters. Pour 500 milliliters of lukewarm tap water into the container. Any water that is safe to drink is safe for an enema. To get the tap water warm, you can either use warm tap water straight from the tap or place the container in a sink filled with warm water. Never warm the water in the microwave. Next, you will add 3/4 of a teaspoon of table salt. Iodized or non-iodized salt is fine. Make sure to use a measuring spoon, not a spoon that is used for eating. It must also be a level 3/4 teaspoon of table salt. Pour the salt into the container with 500 milliliters of tap water and stir. You now have saline for the enema. The enema bag has a roller clamp to allow for control and adjustment of how fast the enema is going in. The first thing you want to do is to roll the roller clamp down to prevent the enema from running. Then you want to hang the enema bag on a doorknob or a hook or a hanger. Make sure the enema bag is higher than your child, but remember, the higher the bag, the faster the enema will run in since it runs in by gravity. Then you want to look at the recipe your doctor prescribed for your child. Let's say the physician wants to start your child with an enema that has 300 milliliters of saline and 20 milliliters of glycerin. You will pour the 300 milliliters of saline into the enema bag. Next, you will either pour the 20 milliliters of glycerin or use a syringe to squirt the glycerin into the bag. Next, you will gently mix the glycerin and saline together by squeezing the bag. Make sure not to shake the bag, as you could create suds. Next, you want to prime the tubing. To do this, you will open the clamp and allow the solution to run to the end of the tubing. If you are having trouble getting the solution to start flowing, you can squeeze the chamber 2 to 3 times to get it started. Then you will close the clamp once the solution has gone to the end of the tubing on the bag. Next, you want to check the balloon on the catheter. You will draw up 30 mL of air on the syringe and connect it to the white port of the catheter. Then you will inflate the balloon with air. If it inflates, then you can remove the air . Then you want to position your child. Your child can be on their hands and knees with their head on a pillow and their bottom in the air. If your child does not tolerate this position, you can lay them on their left side with their knees to their chest to administer the enema. Then you want to lubricate the catheter with water-soluble lubricant Do not use Vaseline, as this can clog the catheter. Then you want to insert the catheter into your child's rectum about 4 to 6 inches. It can be helpful in the beginning when you're learning the enema process to mark the catheter with a permanent marker at the 4 to 6 inch mark. If you are not sure if you are in far enough, you could advance the catheter a little further. You cannot hurt anything by going further than 4 to 6 inches. Once the catheter is in about 4 to 6 inches, then you will inflate the balloon with the 30 mLs of air. There may be times when your child's doctor will prescribe smaller volumes of air, so always be sure to use the amount that was instructed to you by your child's doctor. Then you want to pull back on the catheter until you feel gentle tension. The balloon on the catheter is what acts as a plug and allows the enema to stay in your child's colon to be effective. You will connect the enema bag to the larger port of the enema catheter and then open the roller clamp. You can start by having it open halfway to see how quickly it drips. We want the enema to go in over 5 to 10 minutes, as this is the most comfortable length of time. If the enema goes in too quickly, it can cause cramping or discomfort. The entire time the enema solution is being administered, you want to hold gentle tension on the catheter to prevent leakage of the enema solution. Once the enema solution has all been administered and the enema bag is empty, you will close the roller clamp and continue to hold gentle tension on the catheter. The enema solution should stay in for 10 minutes. Your child may feel a sense of fullness or pressure and ask to sit on the toilet before 10 minutes. The enema is more effective the longer your child retains it. If your child is having trouble holding the solution, try having them blow bubbles, read or imagine, or watch a video to help them relax and take their mind off of the sense of fullness or pressure. After the 10 minutes, have your child sit on the toilet. Then you can connect the syringe to the white port on the catheter and remove the air from the balloon. Then you will remove the catheter from your child's rectum and have them sit on the toilet for 45 minutes. Make sure to distract them during this 45 minutes. You can use a book, a movie, homework, or a special toy that is special to this time only so that it is more distracting. If your child's feet do not reach the floor, you can use a stool or chair to rest their feet for comfort. Your child may have a hard time sitting for that long. It's okay to give them a stand-up break after the first 15 to 20 minutes of sitting. Have them stand up for 3 to 5 minutes next to the toilet in case they have more leaks of the enema solution. Standing up will also allow more solution and stool to move down towards the rectum and prevent future accidents. Finish up the remainder of the sitting time after the break. After you have finished with the enema, rinse the catheter out. Fill the bigger syringe that holds 60 milliliters with warm soapy water. Connect it to the larger port of the catheter and flush the catheter. Then you will rinse the catheter in the sink with warm soapy water to clean the outside. Leave the catheter to air dry. Then you want to run warm water through the enema bag to flush it out and leave it hang to air dry. After you have finished, wash your hands thoroughly with warm soapy water. Remember that the enema process should be a positive event. This is what decreases the symptoms of belly pain and bloating related to constipation and helps your child remain clean of stool on a daily basis.